Hello, Dr. Jolly and classmates. I will be presenting on psoriasis. Psoriasis is a lifelong chronic autoimmune skin disease with no cure that involves episodes of flare-ups of the skin and remissions. Those who have psoriasis often have inflamed and scaly skin, and this is due to immune cells that become active and generate molecules that set off the fast growth of skin cells. There can also be a genetic predisposition, and environmental triggers play a big role with psoriasis. There are 6 types of psoriasis. There is plaque, nail, inverse, guttate, pustular, and erythrodermic. Demographics. Peak ages for diagnosis is going to be between 15 and 35 years of age. Psoriasis affects men and women equally. In recent years, there have been 8 million Americans with the condition. 10% of patients who have psoriasis have a psoriasis gene. 14%, there's a 14% chance of someone developing psoriasis if mom or dad has it. So as you can see, it's pretty low. I also wanted to mention that someone who has a mom or dad that has psoriasis, it is possible for their child to inherit the psoriasis gene and never develop it. Here are some global demographics. So there was a study done in 2017 that collected all of the psoriasis cases. And so here we can see just briefly, there is a scale on the lower right-hand side. The lighter purple, shades of purple are going to be less cases. The darker in color are going to be more cases of psoriasis. So the United States, you can see, falls in the middle at 1.12%. Australia is at 1.88%, and that's going to be the highest, the country with the highest number of psoriasis cases. Taiwan is going to be at the lowest. I also wanted to include there are no mortality rates because psoriasis is not deadly. Here is the anatomy of psoriasis. Here is a picture of the skin layers. We have someone on the left with no psoriasis, someone on the right with psoriasis. And you can see that top layer of skin is very thick. There are plaques and scales on top of the inflamed skin. Physiology of psoriasis begins with a trigger, as you can see in this illustration on the left-hand side. So the skin feels a trigger, and there are stressed keratinocytes that then activate dendritic cells. And these dendritic cells create inflammation. And then more immune cells are activated. And then we have cytokine production. And this is what activates keratinocyte activation. And so basically what that all means is there is an attack of white blood cells in someone with psoriasis. Just to review what white blood cells do, they protect our body's immune system. So they prevent us from getting sick, or they attack bacteria and viruses that are in our bodies. So with someone with psoriasis, this is not the case. Their white blood cells instead attack their body's skin cells. And so this causes an overproduction of new skin cells, which causes a flare-up. Briefly, I wanted to mention that someone with psoriasis will have an overproduction of new skin cells within 3 to 4 days. The average person sheds their skin around 30 days. So as you can imagine, it's a really fast production of new skin cells. General symptoms are going to be patchy rashes that can range in differences as far as sizes and shapes, spots of dandruff-like scaling. Rashes will vary in color depending on the person's color of skin. White skin is going to show pink or red with a silver scale. Brown or black skin is going to show shades of purple with a gray scale. Skin that is cracked will tend to bleed, soreness, burning, or itching of the skin. Symptoms by type. So each type of psoriasis is going to have some symptoms that are different from each other. Plaque psoriasis is the most common type of psoriasis that is marked by dry, itchy, raised skin patches called plaques that are covered with scales. And these will typically be seen on the elbows, knees, lower back, and scalp. Nail psoriasis, this is where the nail can have abnormal growth, discoloration. It could even loosen from the nail bed. Guttate psoriasis, this is usually seen in children and young adults. It's usually triggered by a bacterial infection, like a strep throat. And this is marked by teardrop-shaped bumps. And this is usually seen on the trunks, arms, and legs. Inverse psoriasis, this is seen in the skin folds. So this is going to be found underneath the breasts, underneath the buttocks. It can even be found in the genital area. Pustular psoriasis is the most rare. This is going to be marked by pus-filled lesions. Erythrodermic psoriasis is the least common. This is when there is severely inflamed skin shedding in large sheets. Okay. Triggers and flare-ups. So some triggers are going to be stress, infections like a strep throat. Some medications can cause a flare-up as well, such as lithium, high blood pressure drugs, anti-malarial drugs, cold and dry weather, trauma to the skin, smoking, and alcohol consumption. Complications that can come with psoriasis can be psoriatic arthritis, depression, low self-esteem, obesity, cardiovascular disease, and Crohn's disease. Diagnosis. First, a physician will collect a medical history from the patient, and then a physical exam will be done to look at the affected skin. And then a biopsy will be done to test the skin for psoriasis in order to rule out other skin infections. Treatment is going to vary on the person, but usually it's going to be creams like corticosteroids, oral medications to reduce inflammation and curb skin cell production, light treatments such as ultraviolet light rays. Biologics are injections, and these are going to be the last resort because there is a risk of developing tuberculosis. So these are usually given when the other treatments are not working. Ways to reduce flare-ups. A person can change their diet, limit their alcohol, limit certain processed foods, maintain a healthy weight, eat a healthy diet. Self-care can be no smoking, managing stress in healthy ways, using a moisturizer, wearing comfortable clothing. Artificial intelligence. There was a study done in January of 2015 that lasted a little more than 6 years. And a deep learning system was created to give a score, which is called a Psoriasis Area and Severity Index score. And this will kind of put a score to the psoriasis that the patient has. So there was 2,336 2,367 patients and 43 experienced dermatologists that were part of this study. The results were successful, and it was found that a 33.2% of this system outperformed the dermatologist assessments, and they developed the Skin Teller app that is currently used in 18 hospitals. And this will give a dermatologist a PASI score. Those are my references, and that is my presentation. Thank you so much for watching.